Good afternoon and welcome to the Multicultural Media Online Conference. And this is hosted by the Multicultural Health Communication Service, the New South Wales Ministry of Health, with the support of Multicultural New South Wales. I'm Jesusa Helaratne, your moderator for these sessions. And today we are talking about Mpox. This week we'll be talking about the infection that's caused by the monkeypox virus. We're now seeing the largest Mpox outbreak in the state since the first case was confirmed in May 2022. Anyone can catch Mpox. Currently, people at most risk are men who have sex with men, sex workers, and their sexual partners. And today we're joined by special guest, Michael Woodhouse, Chief Executive Officer of AIDS Council of New South Wales, or ACON, and he's joined us online. Hello, Michael.
Hi, lovely to be here.
Thank you for joining us. And we also have Dr. Rohan Bopage, Senior Staff Specialist and Clinical Lead of the Sexual Health in Western Sydney Local Health District. Dr. Rohan, thank you very much for joining us.
Great to be here. Thank you.
Thank you. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to Aboriginal colleagues who may be joining us in this session today. We also would like to pay respects to elders past and present, and also respect those who are from multicultural leaders and groups, multicultural groups and refugee groups who may be represented in this session. We shall start the conversation now. Dr. Bopage, Rohan, since 2024, we've seen a spike in Mpox cases in New South Wales. Can you tell us a bit about the virus and the current situation and what your role is in starting these conversations with patients?
All right. So I'm a doctor. I'm a specialist in sexual health medicine. I'm based in Western Sydney Local Health District, and our clinic based in Parramatta. So Mpox is an infection caused by a virus, the Mpox virus, and that results in skin lesions and can cause other symptoms like fever, fatigue, enlargement of the lymph node, and other symptoms. And there are two distinct types of this virus. So currently circulating in Australia is called clade 2B. So we are referring to that, the technical term clade is a type of that same virus. And there's a different infection in Central Africa, which is 1B. And we haven't seen cases of 1B in Australia. So today what we're actually discussing is clade 2B Mpox.
And I think that's really important to clarify. We're seeing in the news a lot of stories about what's happening all over the world, and especially in Central Africa and West Africa. But we should be concentrating, and that people who are watching today should really remember that it is 2B that we're experiencing.
Absolutely. And there are differences in terms of how severity, how it is transmitted. So far, we haven't seen clade 1B here. And there are good systems in New South Wales Health and active surveillance. So we haven't seen that. Hopefully it won't come to us, but we always be alert if that happens. And then we will make our changes into control Mpox if that happens.
What are the numbers now, Dr. Rohan?
So 2 days ago, the numbers released from the New South Wales Health, there are 494 cases since the 1st of June. This is the current outbreak started. And this is largely confined to men who have sex with men. They are gay, bisexual men and other men who hasn't identified as the gay, bisexual men. And also very small number of females and trans and gender non-binary people. And the cases we have seen largely, nearly 60% of them has not had vaccination for Mpox. Those who had vaccination can get Mpox, but what we have seen, they get less severe symptoms. And also if they get infection, they'll have less number of lesions and they resolve the symptoms quite quickly.
Well, that's really important, right? That people should get tested. Now, what are we seeing? We're seeing in the news the different things that are happening in Central and West Africa. What are the things, the symptoms that we would receive? I know you mentioned about fatigue, but what should they be really careful of?
The Mpox start with usually skin lesions. They can be just a pimple, and usually they are painful and they're multiple. And they could be in anywhere in the body, but usually starts in the genital regions. And sometimes these lesions are in places that you're necessarily able to see. For example, it could be between your buttocks or could be closest to the genital areas, or sometimes inside the mouth. So first symptoms might be pain, and these pimples, they are red and painful, and within days they turn into like a fluid-filled blisters. They call the vesicles, and within days then they pop, they become ulcerated, and also become a scab over. And the other important thing is these lesions can appear on different times, not necessarily they all appear at once. You might get 1 or 2 lesions in your genital area, and suddenly after 2 days they'll be in the face, it'll be in the arms, and they could be at different stages. And also what we started to see, when we get these lesions, people get fever and exhaustion, fatigue, sometimes a very severe muscle aches, and also enlargement of the lymph glands. And they're the main symptoms. And these illness usually lasts for 1 or 2 weeks. And some people, it can go on to 2 to 3 weeks. And the lesions sometimes could be any part of the body and could be severe and very large, particularly those who haven't had the 2 vaccinations. Most of people who got Mpox, it get better just by symptomatic treatment. I mean, taking some rest, Panadol, hydration, and painkillers. But some people, it gets severe and they need to go to hospital. And these are the majority of people who ended up in the hospital are those who haven't got these 2 vaccinations. That's why it's really important to get vaccinated. It will reduce your risk of getting infection, Mpox, but also, most important, it will reduce you getting sick and getting to the hospital.
Thank you, Dr. Rohan. And Michael, vaccinations is important. And I wanted to ask you about your role in ACON and how important the messaging needs to get to the people.
Yeah, and thanks very much. ACON is an organisation with a really long history delivering HIV responses and other work for promoting the health of LGBT community right across the state, right across the city, and increasingly across the country as well. Look, vaccination's obviously really important. I think Rohan's just outlined all the reasons. It's our best line of defence here. I know from speaking to people who've had Mpox, those who had vaccinated had a much easier time of it in general than those who have not. And everybody agrees that if you can get those 2 doses of vaccine, then that's much better than having an experience of having Mpox. We've certainly been putting out quite a lot of messaging in particularly the channels that we have, particularly to reach gay and bisexual men. And I think one of the things we've been trying to particularly make sure people realise is that there is a reasonable number of cases going around at the moment. So now is actually a good time to get vaccinated. For people who might have been aware of Mpox but weren't sure whether or not there was really a need to get vaccinated, our call has been actually now is a very good time to get vaccinated. It's an easy thing to do, so we'd really encourage people to do so.
Can you book to get vaccinated? Is it like you said, it's easy? What are the steps for people to take?
Yeah, so there's a number of places people can get vaccinated, particularly across sexual health clinics right across the state. Some general practices will be able to assist, but not all GPs will have the vaccine. So sexual health clinics are probably the easiest place to go. I think it's important for people to know that they're really private appointments. This is confidential. We understand that not everybody is going to want to or may have some fear about talking about their activity and how it is they might have been exposed to Mpox. I know we can absolutely trust Rohan and his colleagues right across the state that the service you'll receive in a sexual health clinic is safe, it's confidential, it's private, and most importantly, you don't need a Medicare card. So for those people who may be here for a while, but don't have Medicare cards, you can still get this vaccine. And it's the best line of protection you can get.
And there are local health districts across New South Wales that provide sexual health services as well.
Yes, absolutely. I think New South Wales Health, the sexual health service across the state, different to some other states, and the vaccination is accessible, free, as Michael said. And also this vaccine, unlike some of the other vaccine, doesn't make you sick much. Obviously, you people can get a little bit of pain around where the vaccine are given, usually into the arm, and it's 2 doses given 4 weeks. And we haven't seen any serious complications for this vaccination.
And you have to take two, isn't it?
Two doses, 4 weeks
You do.
apart.
Okay.
Yeah. And we're
And-
aware that there's some people who might have had their first dose but haven't got around to their second. So that would be a good thing for people to remember, and perhaps to be reminding people who have some awareness that if you've started the course, it's a good thing to finish it, and that it's not too late, even if it's been a bit longer than that 28 days.
Yeah, and I guess what we want to also emphasize here, because a lot of people would be confused about Mpox, monkeypox, measles, chickenpox, you were saying, Rohan, while we were starting our conversations. Can you tell us more about that and how people can, really be sure of how to distinguish?
Yeah, so it can be confusing because they all have rashes, and they can also ended up having the similar symptoms like fever, fatigue, and they're all red and painful. But there are some characteristic features, so your doctor will be able to see and also organize the testing. I think testing is the key. If you think you have Mpox or you're at risk of Mpox and have these similar symptoms, it is very important you reach out to your doctor or your sexual health clinic doctor or a nurse and get a test done. Test is easy. It is a swab and sent to the lab. Usually within few days, the results will be back. And while you're waiting, follow the advice and avoid having contacts with them. There are some what is called the atypical. The symptoms can present as something else. Sometimes things like herpes or chickenpox, measles, but they don't have the classic signs of Mpox. That's why the testing is important. Testing is highly sensitive and specific, and it is free.
It is free. For those listening in, please put your questions on the chat, and Dr. Rohan and Michael will be able to answer your questions. And it's really a great opportunity to really talk about this more, because we see it in the news, and it's really affecting a lot of people when they see the news. Michael, when in ACON, you said that conversations are confidential, and how do we go about talking about this, especially with the community?
Yeah, and look, I guess we are certainly aware that there will be gay and bisexual men who are having sex with men who, for whatever reason, don't want to be particularly public about their partners and their behaviour. So I think all of the things that I know many people right across the health system are incredibly skilled at about polite and confidential and respectful conversations, so that we can be steering people in the right direction. I think what's really important, and I know we have many people online from multicultural media here, is being able to be reassured that if you were to go to a sexual health centre, that's a really confidential space. You can trust that you're going to have both a welcoming and a confidential experience there. You don't need to be doing a whole lot of disclosure about things that you may not be ready to talk about. What you can do, though, is have a clear conversation about your health, get the protection that you need, and certainly be confident in the knowledge that then you've got the best protection we have against a growing illness in our community.
Thank you, Michael. No, in Mpox, we want to talk about, you talked about the symptoms, but how could this be transferred?
So the current outbreak that we're talking, the 2B, it is transmitted through very close skin-to-skin contact. So like sexual activity and sometimes kissing, hugging. And also we have seen where the things like clothing, some bed linens who's been in contact with the fluid of the lesion and then can be transferred to others. For example, sharing towels or sleeping on the same bed. It is not the most common. The majority of cases we have things, some sort of sexual activity or very close skin to skin. That means if you're living in the same house, you are not at risk unless you share the bed or the clothing or have very close skin to skin contact.
So following the habits that we've learned through COVID, that's important. Washing your hands.
Absolutely, it helps. Infection control is very important, and that's why I don't think there's no need to be alarmed by having somebody who is Mpox living within a household, as long as you can follow these infection control measures and limit your close skin to skin contact, you are not at risk. But if you think you have a potential contact, it is very important, again, you act fast. Because if you haven't had these 2 doses of vaccination before, we can offer you post-exposure vaccination and post-vaccination to prevent you getting or reduce your chance of getting Mpox. And it need to be given sooner, ideally within few days, but can be given up to a couple of weeks. And again, as Michael said, it is available through sexual health clinics and some GPs and some emergency department. And also I would like to reiterate the services we provide in sexual health services and GPs, they're confidential, they're safe, and we'll respect your privacy. And also you don't need to share everything. If you're worried about it, you can actually use some of the alias names. You might not even have to give your real details. So I think that message is very important for some of the culturally and linguistically diverse people, because there is some fear because this is a sexually transmissible infection. So there might be some concerns. But if you come to a sexual health clinic or these GPs, we will respect your decision and we will provide a safe space.
There is stigma about health in communities anyway. How do you deal with that with your conversations?
I think it is always providing that welcoming, safe place. Then people start to trust you. And the trust is really important. And the trust at different levels with providing the confidentiality about their health information. And also how we treat them. And also respect their boundaries. And started that conversation, and then they'll be able to disclose some of the things that probably at risk or they might have some symptoms. So we have seen some of the cases people present quite late because they have this fear that when you go to a clinic, they might judge you because you may have had to have sex with a man, but you don't identify as gay. And then they will wait until the symptoms are quite bad and they might have to go to emergency department. So our message is come to sexual health clinics or the GPs, and we will provide you a safe place to discuss this.
Thank you, Dr. Rohan. And they can go to ACON, Michael.
Look, I think I obviously agree with everything that Rohan's been saying, and the network of sexual health services do an excellent job right across the state. I think the other point that I'd probably reiterate is sometimes we hear that a number of people expect that because there's a service being offered by the state that it's going to cost them something, particularly if they don't have a Medicare card. That's not the case for this one. So this is free no matter who you are, and all of the great benefits that Rohan's been talking about are also extended to anybody who's here who doesn't have a Medicare card. So this is a very simple thing for people to do, and I think certainly perhaps not everybody realises that services such as this are so broadly available to anyone who might need them who's living in our community.
Michael, I'd also like to ask you about misinformation or where to get information, trusted resources on matters like this because of what's happening in the news and how, this has happened through COVID, where information, when you're overseas or you're listening to information from other states. Here in New South Wales, what are the things we should be mindful of?
I think in fact, in the chat to this presentation, someone just recently posted a link through to the New South Wales Health website. I think that's the best place people can go for understanding what's going on with Mpox right now here in New South Wales, including the places that can offer the treatment that we need. I'm not hearing massive amounts of clear misinformation. I think what I'm hearing is that most people understand that the vaccine is reasonably easy, that it's a pretty simple to take vaccine. I am hearing, as you've been highlighting so well for us, just a little bit of confusion that actually the experience that's happening overseas is not the experience that's happening here in New South Wales, and in particular that whilst anybody could get the strain of Mpox that is happening here in New South Wales right now, it's particularly gay and bisexual men who have sex with men who are most exposed. And so that's why we're trying to keep our focus particularly in to those groups of people who are most likely to become exposed to Mpox at this point in time. But I really would like to sort of underline what's happening here is very different than what's happening in Australia. There are so many, A, it's a different strain. B, we're in a health system where it's obviously so much easier to get to really large numbers of people and provide vaccine at scale. Not something that every nation overseas enjoys. Um, so I don't think this is one for people to feel panicked about. I think this is a increase in cases that is well within our capacity to control, and would really appreciate the help of people on this call and people across the community in getting that message out, particularly to gay and bisexual men and to men who have sex with men, that look, the easiest thing to do, go out and get a vaccine, and you're going to be okay.
Thank you. Dr. Rohan, in your role, this is an everyday thing that you experience, and what other advice would you have for other health workers who do work with communities and clients when talking about Mpox?
I think a couple of key messages. One thing is a vaccination. Yeah, the role of vaccination, I think the best strategy we can reduce the complication, prevent, and then control this outbreak going on. So getting the message across, those who are at risk, get these 2 doses of vaccination. Second thing, the easy access for services and testing. And the symptoms sometimes could be atypical. And your doctor might not be very familiar, but you could actually ask your doctor. I heard this on, say, in the New South Wales Health website or from ACON, and I'm at risk. Could you please consider? I think it's a very valid question. Or you could come to a sexual health clinic or go to the website, or you could call ACON or also sexual health info line. And the other thing is, if you diagnose with Mpox, again, it's very important to follow the infection control, because you want to limit your exposure to others and then prevent transmission to others. So it started with the testing and then infection control. And also, if you think you're being exposed to, there is a vaccination available. And again, you need to act fast. And again, that's free, easily accessible, even without a Medicare card.
And you said that you also mentioned, Michael, that going to a sexual health center is important, but also that it's available, information is available in language if you need language support.
Indeed.
And there is a
here
translating
on the New
interpreting
South Wales,
service.
that's right, translating and interpreting service on the New South Wales Health website. There's information there for people who need it.
And Rohan, as a doctor, and I guess this is important, that healthcare interpreter services are available.
So where I work in Western Sydney, we use healthcare interpreter service quite often, and there are lots of other ways. We can use a telephone, you can use an AV, audio visual interpreter service, and also there are lots of materials in other languages as well. So if you have trouble communicating with English, don't hesitate. We could arrange an interpreter service for you, a professional interpreter service for you.
Rohan, you've been in this job for a long time, and you say that these terms are, we mentioned before that if sometimes if you're not familiar with it in English, you can go into to language and looking at it in language. This is not something to be scared of. This is something. This is, as you said, it's an infection that could be healed.
Absolutely. Vast majority of cases, I would say 99%, the infection, the illness resolved on its own, week or 2, only need to take some Panadol, some good hydration and rest. Only minority of people who has to go to the hospital. Again, there was no death in Australia. I think that's why we started these 2 different things, what Michael also mentioned. The clade 2B, what's circulating in New South Wales, is very different to what we're talking about clade 1B. We haven't seen deaths, and the people recover after a couple of weeks. And again, those who ended up in the hospital, mainly they went there for pain relief. There are only small number of people who ended up having complications so when you have these lesions, when they pop out, they are at risk of secondarily getting infection, what they call cellulitis. And then that can spread. So that's why they need to introduce antibiotics. And very rarely are the complications like infection in the eye, which is very rare. So we would like to send the message, this is a self-limiting illness. Without majority of people will get fully recovery after 1 or 2 weeks.
Thank you very much. Michael, you mentioned that there is no Medicare needed, and that
That's right.
people who are visiting overseas or are here on a temporary visa, they can use this service and get
Yes.
vaccinated.
Yes, absolutely. And be really keen for that message to get out quite broadly. I understand that might feel unusual for some people that we're trying to reach here, but I think it's really important for people to understand that this is free and available to everybody who's here in Australia, not just those of us who have Medicare cards.
Thank you, Michael. I wanted to check with you. If you were could you have Mpox and then have it again?
So far, we actually haven't seen that. What we have seen, people who had vaccination can get Mpox. Vaccination does not necessarily prevent you 100%, but it will reduce the risk, it reduces severity. But as Michael mentioned, when you get Mpox, if you had vaccination, you'll have a less severe disease. But there are cases being reported, people have recurrent infection, but we haven't seen that yet.
Oh, that's good to know. So there's no evidence or cases that have shown that.
So once you have the infection, you'll have the immunity that lasts you for a long time.
Wow, that's really good.
That's really
so
good.
As you said, 28 days, 2 doses.
Yes, correct. At least 4 weeks apart. Not necessarily have to be exactly. Minimum is 4 weeks apart.
Michael, with your role with ACON, these are some of Mpox is just one of the topics and issues that you encounter. Can you tell us more about how you deliver messages into the community and to your role with ACON?
I mean, a lot of the work we do here at the organisation is focused around HIV and sexual health. The work in HIV has been not just our work, but the work of the entire system around HIV has been extraordinarily successful in the last few years. HIV, when I think back from my younger days and the real difficulties around HIV and AIDS, it really has changed significantly here. Interestingly, there's some similar messages here. We're now in a place where for people who might have HIV or might be exposed to HIV, there are really very simple ways of managing your health, particularly for gay and bisexual men. PrEP, pre-exposure prophylaxis, as it's called, a simple daily pill, is now one of the most effective protections that's available to people that will actually very, very effectively stop HIV transmission. We're aware that perhaps not everyone in the community quite knows about that and knows that as widely as we would like. I know we're certainly trying to find new ways to work with communities, particularly across Western Sydney, to try and get that message out, because we know that there are people who still haven't heard or haven't found access to what's a really very simple preventative treatment, and will further reduce the number of people who are becoming HIV positive here in New South Wales.
And as you said, it really is just important to be able to share information with networks, isn't it?
Absolutely. It's one of the things that we at ACON take very seriously, and I know we're always very happy to work with people who perhaps might be on this conference or who would like to reach out and be partnering with us around how it is that we get the messages to all of the people who need to hear them. It's a really important part of our work, and we really look forward to working in partnership with anyone who's interested in being part of that.
Thank you, Michael. And yes, and thank you for all the work that you've been doing to make sure that we are able to deliver the right information on Mpox. Dr. Rohan, we've run out of time, and I think we were able to deliver the key messages. One last final words for the community, for the media who will be hearing about this, and to the health workers and the community leaders. What should they be just delivering the messages to the community?
I think what the key message I want to say, the services are free and accessible and safe. Do not hesitate to reach out to sexual health clinics, doctors, and also community organizations like ACON, New South Wales website, Sexual Health Info Line. And there are easy access for vaccination, easy access for testing, and easy access for care if you have Mpox. And also Mpox is a self-limiting illness. Most people get over it within weeks or so. So what we are seeing in New South Wales is not what we are seeing in Central Africa.
That's the important message to tell everyone. And Michael, any last words?
Look, I think this is something we can absolutely, by working together, get on top of. I think all of the things that Dr. Rohan has just said are really important. There are some simple things we can do, particularly for gay and bisexual men and men who have sex with men. Get those vaccinations done, and I think we are likely to see these numbers drop.
Thank you very much, Dr. Rohan and Michael, for joining us today, and for you all watching this session. And we thank you for delivering the messages to your networks. And there are resources available in multiple languages. Please check out the website on New South Wales Health and contact ACON as well, and your local health district sexual health centers if you need support. This has been another Multicultural Media Online Conference brought to you by the Ministry of Health, Multicultural Health Communication Service, with the support of Multicultural New South Wales. We'll see you again next time.